So, who's really in charge of your health care? The doctor who you see and trust, who examines you, who knows everything about you? Or the insurance companies, who actually dictate to doctors what medicines to prescribe and which tests he's allowed to order? Some of what you're about to hear may surprise and shock you. Welcome to the State of Medical Care, 2012.
What's happening is that I'm examining patients, I'm spending time with patients, and then I'm asking for specific tests. And I ask for specific tests, and I'm being denied for the well-being of my patient. The insurance companies have no respect to patient-doctor relationship. And that compassionate relationship is very powerful. It's so powerful that it establishes trust. And whatever that doctor feels is necessary, that patient will do, provided that that doctor is altruistic for the benefit of that patient. If I believe that after I evaluate you and I spend the time examining you, that this is the best for you, then whether the insurance company wishes to pay or not pay, it's your responsibility. But I'm not going to do this test if I don't examine you to make the correct diagnosis and to determine the correct test. And if I come out with not just one issue for the test, but I have cross-checked myself that the exam focuses towards it, the blood work focuses towards it, your symptoms focus towards it, what do I need to make a definitive diagnosis? I order a specific test, the patient needs emergency surgery, saves the person's life, the insurance company considers me a high-cost physician. By considering me a high-cost physician, insurance companies lose a tremendous amount of money on the PPOs. While the insurance companies do not have a medical license, nor do they have a medical understanding, they dictate to the physicians what medications to give, how much time to spend with the patient, and what procedures can or cannot be done. Their main objective is to make money. Main objective of CEOs is to make money. This type of behavior will ultimately go to a direction that will eliminate compassion. Individuals will be going into a room, they will be evaluated by a machine, some extender will come out and give a diagnosis and you'd be on your way. The essence of medicine will be lost. Technology does not have a bedside manner. You must have them together. But sometimes it's compassion with your patient. They go out, no test. Thank you, doctor, I feel good. A pat on the back. Don't worry, everything will be okay. This is the essence, not the only essence, but this is the essence that must go harmoniously with technology. Right now, we need to bring our compassion up to par. And so far, the insurance companies, the CEOs are strictly based on monetary wisdom, and that will never satisfy our human need. It will never satisfy our human need. You know, years ago, physicians that did primary care took care of the patients. They took care of them from every level, and they spent time with them. As a physician, I have been questioned by Aetna continuously to be part of their physician for their managed care for the elderly. They have called my office greater than 20 times, continuously asking me to participate. I told them that I do not wish to participate in a managed care program for elderly people. Elderly people themselves need more time. And with the managed care programs, it's going to eliminate a considerable amount of care, and it's going to eliminate the appropriateness of evaluation, the appropriateness of diagnoses and evaluation. After that, it was very interesting that I received a letter from Aetna telling me that I was no longer a provider for them as of June 12th, 2012, and that my patients will no longer be able to see me. I then contacted Mark Bertolini, the CEO of Aetna. I was told that Mr. Bertolini does not speak with doctors. I think it's amazing that as a physician, trying to save lives and help individuals is controlled by an individual that made $8 million last year, and he's not a physician. He's directing healthcare. He's some great entrepreneur that's going to change the world in technology. And he doesn't have time to speak with physicians. And what is his main objective if it's not the objective of my patient care and my patients? I would say to doctors, they went to medical school, they sleep at night, they love their profession, they have a great respect for this noble profession. Stand up and practice their noble profession. And if they do, everything will fall into place. Don't practice what somebody tells you to practice. Practice what you learned. Practice what your intuition is. Practice what you believe in your heart of hearts. Practice what it means to be a physician in this 21st century. And practice it with like it's your last day on earth.